What are the risk factors for developing diabetes? The risk factors for developing diabetes really fluctuate contingent upon where an individual lives. This is to a limited extent because of the condition the individual lives in, and to some extent because of the hereditary cosmetics of the family. In the United States, it is evaluated that 1 of every 3 guys and 2 out of each 5 females conceived in the year 2000 will create diabetes, the lifetime chance. It has additionally been determined that for those determined to have diabetes before the age of 40, the normal future is diminished by 12 years for men and 19 years for ladies. The risk for developing diabetes increments in specific cases, for example, the accompanying hereditary qualities. People with a nearby relative with type 2 diabetes are at higher hazard. Ethnic foundation. For instance, the genuine pervasiveness of diabetes in the Caucasian populace of the US is about 7.1%, while in the African American populace, it increments to about 12.6%. Roughly 8.4% of Asian Americans and 11.6% of Hispanic Americans are influenced. In a very much considered gathering of Native Americans, the Pima Indians, the commonness increments to practically 35%. Birth weight. There is a connection between birth weight and creating diabetes, and it's something contrary to what one may naturally think. The lower the birth weight, the higher the danger of type 2 diabetes. At the opposite finish of the range, a high birth weight over 8.8 pounds or 4 kilograms additionally is related with an expanded hazard. Furthermore, moms of babies who had a higher birth weight more than 9 pounds are at expanded hazard for creating diabetes. Metabolic disorder. People who have the metabolic condition are at particularly high hazard for creating diabetes. Heftiness. Obesity is likely the most amazing danger factor and much of the time the most controllable. This is to some degree because of the way that heftiness builds the body's protection from insulin. Studies have indicated that inversion of corpulence through weight decrease improves insulin effectability and guideline of glucose. Be that as it may, the appropriation of fat is significant. The great, pear, molded individual, littler abdomen than hips, has a lower danger of creating diabetes than the apple, formed individual, bigger around the midriff. The specific explanation behind this distinction is obscure, yet it is thought to have something to do with the metabolic action of the fat tissue in various territories of the body. Gestational diabetes. Women who have gestational diabetes during pregnancy have a more serious hazard for creating type 2 diabetes sometime down the road. Autoantibodies. The nearness of harming insusceptible framework cells, autoantibodies. Once in a while relatives of individuals with type 1 diabetes are tried for the nearness of diabetes autoantibodies. On the off chance that you have these autoantibodies, you have an expanded danger of creating type 1 diabetes. Be that as it may, not every person who has these autoantibodies creates diabetes. Hypertension. Having circulatory strain more than 140/90ths of a millimeter of mercury, mmHg, is connected to an expanded danger of type 2 diabetes. Polycystic ovary disorder. For ladies, having polycystic ovary condition, a typical condition described by unpredictable menstrual periods, abundance hair development and stoutness, builds the danger of diabetes.